Hey everyone, welcome to this explainer. Today, we're diving straight into the hard science behind ginger. We're taking it out of that folk remedy category and putting it right under the clinical spotlight. If you think you know all there is to know about this little root just because, you've tossed it in some tea or had it with sushi, well, you are in for a serious surprise today.
So, let's kick things off with a question that might just change how you look at your kitchen pantry. We have all seen ginger totally hyped up on wellness blogs, right? But is it just a tasty spice, or is it an actual medical powerhouse backed by rigorous clinical trials? Well, as the data shows us, the answer is absolutely fascinating, and actually comes with a few cautious warnings too.
What's really wild here is that ginger isn't just food. It acts as a highly potent biochemical agent in your body. When you consume it in concentrated amounts, it literally alters your cellular chemistry. It's got these clinically proven benefits for your heart and your immune system, but, and this is a big but, it also packs some serious pharmaceutical interactions that most people are completely unaware of.
So, here's our roadmap for today. First, we'll look at the science of ginger, then how it fights chronic inflammation, followed by its effects on your heart and blood sugar. After that, we'll hit the dosage sweet spot, and finally, we're going to cover those dangerous drug interactions.
All right, part 1, the science of ginger and its active compounds. Let's get right into the actual mechanisms that make ginger tick, because we really need to understand the underlying biochemistry before we can grasp its real clinical power.
Take a look at these 3 main compounds. It's so cool because it shows that how you prep your ginger actually changes its chemical makeup and what it does inside your body. Slice up some fresh ginger, you're getting gingerols, the primary active compound. But if you dry or heat it, boom, it transforms into shogaols, which actually pack an even stronger anti-inflammatory punch. Cook it, and you develop gingerols, which is a massive antioxidant. You're not just cooking, you are literally doing chemical engineering right there in your kitchen.
Moving on to section 2, fighting chronic inflammation in the immune system. Let's see how these compounds team up to go to war against chronic inflammation.
Okay, to really get ginger's power, we have to talk about something called netosis. Now, in conditions like lupus or rheumatoid arthritis, your white blood cells can basically go into overdrive. Imagine these nets as microscopic spider webs that your white blood cells just start throwing out. And these webs, they actually trigger severe inflammation and clotting. It's basically your immune system going totally rogue.
And that brings us to a really groundbreaking study out of the University of Colorado Anschutz. Clinical trials showed that giving healthy volunteers just 20 milligrams of gingerols a day boosted a chemical inside their white blood cells called CAMP. So what does CAMP do? Well, it actively restrains those inflammatory microscopic spiderwebs. It stops the cells from throwing out the nets, literally calming the immune system down at a cellular level.
The main takeaway here is that ginger isn't just some soothing tea ingredient, it is pharmacological. It actively blocks the exact same inflammatory pathways, specifically the COX and LOX enzymes that a lot of your standard over-the-counter pain relievers target. It's shutting down the production of the very molecules that cause pain and joint stiffness in things like osteoarthritis.
All right, section 3, heart and blood sugar, looking at cardiometabolic health. Pivoting away from the immune system, the data we have here is incredibly compelling if you're keeping an eye on your heart or your blood sugar.
Check out this number, 1.52 kilograms, which is about 3.5 pounds. That represents the average weight loss seen in clinical trials when participants took just 2 grams of ginger every day for 8 weeks. Now, to be clear, it's not some magic weight loss pill, but it really highlights ginger's ability to rev up energy metabolism and promote fat oxidation. It's getting under the hood and actively working on your metabolic engine.
But it goes way beyond just dropping a couple of pounds. Ginger actually tackles the root causes of metabolic syndrome. We're talking about improved insulin sensitivity, which significantly drops fasting blood glucose and HbA1c levels over time. It helps sweep out triglycerides and that bad LDL cholesterol. And get this, it exhibits vasodilating effects. That means it helps relax your blood vessels, functioning almost like a mild blood pressure medication. Pretty amazing, right?
Which brings us to section 4, the dosage sweet spot, where we learned that more is definitely not always better. Hearing all these benefits, you might be tempted to just go grab a spoon and eat the stuff straight from the jar. But let's ground this in clinical reality for a second.
4 grams per day. That right there is the FDA-approved safety threshold for adults. If you push past that, and especially if you start creeping over 6 grams a day, the benefits actually drop off.
Worse, you can trigger the exact problems you're probably trying to avoid, like severe heartburn, nausea, bloating, and just general gastrointestinal misery.
We really need to highlight the huge difference between your kitchen and the pharmacy here. Tossing some ginger in a stir-fry, baking some cookies, or brewing a normal cup of tea, totally safe for pretty much everybody. But when you start messing with highly concentrated supplements like heavy daily capsules, liquid extracts, or those super potent wellness shots, you cross over into that clinical dosage zone. And that is where real medical risks get introduced.
And that leads right into Section 5, dangerous drug interactions and some crucial warnings. Because ginger acts exactly like a medicine in those heavy supplement doses, it absolutely interacts with prescription medications.
Please pay close attention to this if you're on blood thinners, diabetes meds, or blood pressure drugs. Ginger naturally thins your blood, lowers your blood sugar, and drops your blood pressure. So, if you mix heavy ginger supplements with pharmaceuticals designed to do the exact same things, those effects stack up. You could tank your blood sugar until you're shaking, drop your blood pressure until you feel dizzy, or even risk serious internal bleeding.
And the tricky part? The interactions don't even stop there. Ginger can actually alter specific enzymes in your liver that process other drugs. That means it can totally change how your body handles sensitive stuff like immunosuppressants, certain chemotherapies, antibiotics, and opioids. It might cause way too much of a drug to dump into your bloodstream, or conversely, too little. You absolutely must talk to your pharmacist before starting any sort of heavy ginger supplement routine.
I really love this quote from Dr. Jason Knight. He's a leading rheumatology researcher at CU Anschutz. The consensus from the medical community is crystal clear here. Ginger is an incredible, powerful natural tool. It has verified biochemical properties that can calm your immune system and protect your heart. But it is meant to complement your existing medical care. It's supposed to be used strategically, definitely not as a replacement for your doctor's advice. So, the next time you reach for it to brew a cup of tea or spice up a meal, I want you to remember the wildly complex biochemistry and the real clinical power hiding inside that humble little root. It's not just flavor, guys, it's literal cellular communication. I really hope this explainer gave you a totally fresh perspective. So what do you say? Will you start treating the ginger in your spice cabinet with the clinical respect it actually deserves? Keep learning, stay curious, and I'll catch you in the next one.